I'm Sarah Coulson. I'm the Activities Coordinator here at Winnie now, and I've been here for 5.5 years now. So obviously the last 2.5 years have been extremely challenging with COVID and all of the protocols that have gone along with that. Not being allowed to have the families in didn't have too much impact for the first few months, but after about 6 months you really began to see it taking its toll. As we're all exhausted from having coped through the last 2 years, and you're just looking for that little end in sight, and there's no other fresh staff coming in to give a break. Being able to have the likes of yourselves come in again now is amazing, and just being able to have new fresh faces in for them to visit and chat with, they're loving it. It makes a huge difference. I think care homes in general are really very much needed because of course we've got an ever increasing population that are more elderly than before, and people just aren't so able to care for them at home. Illnesses like dementia and Parkinson's and so on. Especially if you've got family that are working, they can't necessarily be there for their loved ones. But it's just so important that they continue to have the love and respect and activities that they've always enjoyed. Just because they've got more elderly doesn't mean that they don't still need that same interaction with people that they've always had. It's given sort of a new lease of life to them again, because a lot of the residents that we've got now have come in during COVID, and they weren't used to all of the good activities that we were doing prior to that. They've not been used to having the different groups coming in, and so this is a whole new world for them, seeing a bit what Winnie now used to be like pre-pandemic. The likes of Marjorie, the change in her has been huge because she has got such a high level of anxiety that when you're not constantly interacting with her, she's wandering up and down the halls all the time, confused, lonely, not knowing where she is, what she's meant to do. But as long as you've got somebody that can actually spend time and do something with her, she's amazing. Even the difference between week 1 and now has been big, because the first week when Jamie and Jack and Leela were here, she sat for I think maybe 20 minutes, half an hour, and then she was away, and then she came back, and she was back and forth maybe 3 times during that session, and then the second I think maybe once, and then just sat right through for the rest. And she's remembering you from one week to the next as well. Instead of being up and down, literally every couple of minutes, she has sat for an entire hour and a half, really engrossed in what's going on, smiling, and it's just wonderful to see the difference that makes to someone. Things like dissecting the owl pellets, they were so into that. They had a great time, found it really interesting, and identifying the little bits of bone that they were finding with what was on the picture bits in front of them. Learning about the different bird calls. There's a lot of ladies that have enjoyed gardening and have loved birds all their lives, but they haven't known the little details that have been brought out by your team. It's getting to do their little plants and things like that. Again, they're not always keen to come out into the big garden. They feel that they're not so able, but when it's just small in front of them and they've got the help, again, it makes the difference to them. The day where you did the mini beasts one was particularly nice as well. It was a really lovely sunny afternoon, but that day we were able to sit just over there, and the sunflowers were in the background, and they were really enjoying interacting with the little bugs that you've got, and learning a bit about them and how each one linked together, and you could see they were really listening and taking it all in and asking lots of questions. So I would say it's definitely had a big impact on their mental health and overall well-being, which as activities coordinator is what I'm always focusing on, is covering all aspects of their well-being. So every week I try and incorporate something physical, something cognitive, something social, something creative, and something spiritual. And the nature aspect really sort of encompasses all of those very, very nicely. It's encouraged friendships between them as well. When you've seen the two different ones sharing notes, or, oh, what do you think of this? Or, oh, look at this little bird, and all that kind of thing. And so, yes, it's been lovely to see the different interactions between them as well as between them and the team. It's just given them something special to look forward to again each week. It is nice always to have something a bit more special that you can say, the Wild Things team are coming today, and wait for the reaction interaction and they smile. Oh yeah, oh they're lovely young people. Oh, that'll be nice. So for some of them, it's reminding them of activities that they'd have done when they were younger. The likes of my grandma that's here. She grew up in Cornwall and she was in the countryside, you know, all the time when she was little. So for her, it's really nice to remember some of that and look back on things. For others, like Kathy, who grew up in Edinburgh, she's not been used to it at all, so it's completely new to her. And either one is great, whether it's reminiscing or whether it's learning something new. And this project, I think, gives a bit of both. And it's lovely for them just to have something that is different from the norm. It's not geared to being in a care home. It's just people coming in that they can get a nice chat with and have something interesting to look at and chat about. And it's not all, oh, you're in a care home, right, let's do bingo, you know, which, yeah, they enjoy bingo, but it's not the same. You know, you get a whole different level of interaction.